Hello, welcome to the resource video to accompany Medical Assisting Medical Insurance Management 1100, MAST 1100. This is Chapter 14, Procedure Coding. Starting from Blackboard and the homepage of the course, we're going to go down on the left column over here to the textbook link. We're going to pull that textbook link out, and to access Chapter 14, we will go to the link MAST 1100 textbook link to Cengage 9th edition. You should have already been able to have access and registered your Cengage Unlimited code to be able to have access to the medical administrative medical assisting textbook that will be used for this course. This is going to take you right into the Cengage MindTap platform. The name of the book, French Administrative Medical Assisting 9th edition, will be at the top. Over here, we are going to click on the Unit 5 little folder. It's going to open up, and our first chapter, click on the drop down arrow, and it is going to produce the reviews, the study forms that you have here, and also the job skills or assignments that you will have in conjunction with this chapter. If you click on the Read It drop down, this will take you to different sections of the chapter. It will bring up the book, and you can continue to read. To get back to that screen, go to the X at the top right-hand corner. The next Study It brings up flashcards. Chapter 14 PowerPoints. Again, these are not required, but these are for your disposal to help study for tests that you have. And then the Apply It arrow drop down, you will have a chapter review. That is just practice. It is not something that is being graded. But your instructor will probably tell you anything that has the orange dots next to it are going to be what you will use or what you will be required to complete for this course. You do have a Chapter 14 quiz. And then the job skills that are a part of this chapter are below. The first job skill that we are going to go over is Job Skill 14-1, Code Evaluation and Management Services. So again, you will need a CPT codebook to complete all of these job skills for Chapter 14. I will give you another area that will help you. I'll point that back out once we finish these job skills. But each job skill will come up with performance objectives, your task conditions, all of the things that you will need. CPT codebook. You don't need a pen or a pencil because you are able to input all of your answers into this Cengage form and upload it. Evaluation and Management Services Guidelines found at the beginning of the E&M section. CPT notes that appear before the subsections and within categories of the E&M sections. I will talk to you and work through the CPT codebook on where you can find that. And then obviously making sure that you read your textbook. I would highly, highly, highly suggest that you read over this chapter before you start any of your job skills. And that goes for any chapter. Directions with performance evaluations checklist. The following divisions in this job skill are designed to acquaint you with various subsections in the E&M or Evaluation and Management section of the CPT codebook. The problems become more difficult as you progress. E&M codes are used by the physician to report a significant portion of their services. Some physicians rank E&M codes on a scale of 1 to 5, with 5 as the highest, most complex level, and 1 as the lowest, least complex level. This terminology appears on a multi-purpose billing form. These levels are determined by the last digit and are broken down as follows. So if you see, we have two sets. We have office visits for a new patient and an established patient, and consultations for an office visit or a hospital visit. Remember, it is the physician's responsibility to assign E&M codes, and this job skill is for familiarization purposes only. In the real world, working as a medical assistant, you most likely will not be. However, it is very, very important that we understand how these codes work, because you may be able to catch a miscode by a physician. They do make mistakes as well. So it's very, very important that we understand how these codes work. They are basically the dollars that we are able to charge a patient based on what they had done. So breaking this down, we have our new patients. They start with 99202. They give a time frame. This is for a 15 to 29 minute visit. We go up. And as you see, as we increase our numbers, we are also increasing the time that the doctor has spent, or the physician, the PA, the nurse practitioner has spent with the patient. So 99203 is 30 to 40 minutes. We have a 99204, which is 45 to 59 minutes, and a 99205, which is 60 to 74 minutes. Not just are they spending all of this time with the patient, most likely there are numerous amounts of tests, diagnostic things being performed on the patient, labs. There may be x-rays as well. So the more complicated a visit is, the higher dollar amount, the higher the code will be. So again, this is going to be for new patients. Our established patients, you notice that we have a new digit. Instead of the 99202, it would be 99212. That 1 is going to signify that this is an established patient. 99212 with 10 to 19 minutes, 99213 with 20 to 29 minutes, 99214 with 30 to 39 minutes, and 99215, 40 to 54 minutes. One thing that you may notice is that the amount of time is going to go down with an established versus a new patient. Why would we think that? Well, a new patient, we know nothing about them. They are brand spanking new. We need to go over a lot of things with them. So more time is usually going to be spent with new patients, and less time because we already have things logged into the computer. We know the patient's history a little bit more than we would with a new patient. Not as much time needs to be spent. When we look at office consultations, same thing. So our hospital office consultations are going to have a 4-2, a 4-3, a 4-4, and a 4-5. Again, starting at interval minutes, 20, 30, 40, 55 minutes. Hospital, you're going to spend a little bit more time usually in a hospital setting. So again, our hospital numbers are going to be, those last two are going to be the ones that are changing: 99252, 53, 54, and 55. And if you notice, with every single column, as the number increases, the time increases, the more things that are going on. So let's start and look at the job skills. I just want to focus on this 1 through 6 first. You notice that this out here in this bold, they are telling you this is going to be a new patient office or other outpatient services. For 1 through 6, you should be able to use the table up here that is provided for you. This is going to be a 25-minute office visit. When you look at this expanded problem focus history, expanded problem focused examination, straightforward medical decision making, this is what goes in to their diagnosis, how much time the doctor is taking, what kind of an examination are they getting, and the decision making, is it pretty straightforward? Are those symptoms directly pointing or to one specific diagnosis, or are they having to dig a little more, do more testing? So this can increase with whatever the patient is showing up with. It can become more difficult for the doctor to come down to just one diagnosis if there's multiple things that it could be. So Obviously, we're going to start with a lower code. Also, make sure you go and read in the book about all of these different options here, these expanded problem focus history, expanded problem focus examination, and straightforward medical decision making. It goes a little bit more in depth. You'll see, though, where this is going to come into play as well when we look at the CPT code book. So again, we're going to come back here. This is a new patient. So this is going to tell me that I'm going to stick in this, didn't mean to do all of them, in this column right here that says new for office visit. We'll just highlight that right there, new for office visit. This is a 25-minute office visit. That right there, that 25-minute office visit is going to tell me that the code will be this 99202, 15 to 29 minutes, because they said they only spent 25 minutes. It's a new patient. It's in the office. So our final answer for our code will be 99202. So all I have to do is come over here and I can type in what the code is and it should save for you. You should be able to put in every code that you find and write it in the line that's provided for you here. Once you get down to the bottom, and you do need to do 1 through 25, all you have to do is save and submit. If I ever ask you, or if your instructor ever asks you to turn anything in on a Word document or any other document other than typing it in on the job scale here, you will click this upload file and you'll upload your document and then submit it. Please be mindful that we are going to ask you to upload either, if you take a picture, only as a JPEG or as a Word document. Any of the Microsoft Office suites should be fine to use here. So you're going to be able to do 1 through 6 with using the table right here on this job scale page. When we come down to code range, starting at number 7, 99201 to 99239, services provided in a physician's office, hospital, inpatient, outpatient, or other ambulatory setting, you're probably going to need the CPT codebook from here on down. So let's just take a moment. We're going to read this. So they're telling me right off the bat that I am going to look in the code range of 99201 to 99239. Office visit is for a 4-year-old male. They are an established patient with an expanded problem focus history and physical examination for earache and dysriosis of feet and low complexity medical decision making. So that's a lot right there. So let's focus on a couple of things first. This is going to be an office visit for a 4-year-old male. They are established. What I'm going to do here is hopefully I'm going to pull up my CPT codebook here. The CPT codebooks you should be able to use from any medical assisting instructor on Lanier Tech campus. This is a 2012, however, you can still use this one. It is perfectly fine and still up to date to use. We do not suggest that you go out and buy one, nor should you use a 2023 or newer. They are not compatible with the Cengage platform. They have changed a little bit, and so this is recommended that you use I believe, 2017 or older CPT codebook. When you open the CPT codebook, there are going to be little finger tabs here that show you different sections. We have our E&M section, anesthesia section, there's a surgery section, all integumentary section, all these different sections here. Also, if you go to the table of contents, it will show you all of the different sections. Evaluation and management, anesthesia, anesthesia guidelines, surgery, and it goes on to all of these other sections. So remember, again, this code range that we are looking for is in the E&M section, 99201 to 99239. And we are going to go to that first section. Evaluation and management code section. Office visit for a 4-year-old male established patient. I'm going to go to where they start the actual E&M section. It'll have a bold title up above. And so it starts off with office or other outpatient services. It told us that this was an office visit for a 4-year-old male established patient. So I'm going to look down, and the first section I come to is for new patient. And that's not where I want to be. Our patient is an established patient. So I am going to go to where the established patients are. And here are my established patients. They start at 99212. These 99212, usually presenting problems are minimal. Typically 5 minutes are spent performing or supervising these services. This patient had an expanded problem-focused history and physical examination. This is telling me that it is a very low presenting problem, very quick visit. So this code is saying that it's not high enough. So we are looking for, and if we go to the next code, we see a problem-focused 99212 is a problem-focused history, problem-focused examination, straightforward medical decision-making. Ours that we are looking for is an expanded problem-focused history, physical examination, expanded problem-focused examination, and medical decision making of low complexity. When we go to 99213, all of the words that were used, and I'm going to come back up here to our job skill. For number 7, office visit for a 4-year-old male, expanded problem-focused history and physical examination for earache, complexity medical decision-making is low. So when we come back here, we see that these 3 markers match the description given to us on the job skill. 99213 would be our answer for number 7. So we will go over here and type in our answer. And then we move on to the next problem. You will continue to do this for all of the rest of this job skill. You will continue to look up. The best thing that I can tell you is to make sure that your descriptions match. Make sure that these 3 bullet points are going to match what your description is given on your job skill. Let's move on to the second job skill. I'm going to go over here to the X, and it's going to bring us back to job skill 14-3, code radiology and laboratory procedures. So again, we're going to need our CPT code book, the radiology and pathology guidelines at the beginning of the sections for CPT, CPT notes that appear before and within the subsection categories. Those are just what I was reading off. The CPT notes that appear before and within the subsection categories are what I was reading right in here, all of these. So when we're looking at this job skill, it tells us that the radiology section and pathology section, it tells us the codes that we're going to be looking for. So our radiology is going to start, let me just get this out. Radiology is going to start with a 70010 to 7999. I'm going to come over to my CPT code book, and I am going to look for the radiology section, which is here in red. So our radiology section, 70010. It's kind of all in red so that you can't miss it. Radiology starts right here. So our first radiology code that we are going to be looking for on our job skill is the X-ray of a hand, 4 views. So I'm going to come down here, and this tells us our subsections are parts of the body. So head and neck, well, that's not going to include our hand. So I'm going to keep going until there's a chest. We have spine and pelvis. We have upper extremities, which I believe include the hand. Yes. So we have upper extremities here, and start at the top and go down to the bottom. And we find here we have radiologic examination hand, 2 views. But we are looking for a hand with 3 views, and our code for hand 3 views, it doesn't matter which it's right or left, 73130. And there you go, you have your answer. You would go ahead and put that code on the line here. Oops, and then you would go on to the next one. When it starts talking about pathology and laboratory, you're going to go from the radiology section, which I believe, yep, pathology and radiology, or excuse me, pathology and laboratory is the next section down. And you will again look for your codes with the examples and the descriptions that they give you in this book. As long as they are matching word for word, you should have your code. If they don't match word for word, it's not the correct code. Moving on to the next job skill, code clinical examples. This one, you may need to use a Word document to be able to upload your answers. There's not really anywhere for you to put your answers here. There is a claim form that they have for you. You can use this, but it can be up to your instructor. I would ask them what they require. But any job skill that has a form uploaded, you should be able to write in all of your dates. You can just fill in everything. And I'm sorry if my hand's a little shaky. I need to be able to show the book and the computer screen as well, but you can just tab over to other areas and you should be able to write on here, save it, and then upload it. This is an example of a document that you would have to save to your computer. And then over on the job skill side, you will have to upload it. This worksheet is an example of an insurance claim form that would be submitted on a patient. This job skill is helping you familiarize yourself with part of what's called the CMS 1500 claim form. If you want to look at the claim form more in depth, if you go all the way over to the full book, we go up here to table of contents. And if you scroll down to where the bottom says appendix, you can see that it takes you to the CMS 1500 claim form field by field instruction. So when it asks you, here's the job skill. When it asks you to insert, let's just say insert data in field 24, if you're confused as to where that is on this form, go to the appendix, go to this claim form. You're going to scroll down to field 24. So we have 24A, 24B, 24C, 24D, 24E, F. this 24A through 24J lines of billed service, this is going to talk to you about the information to put, where it's located. If you go through it, see here's our 24A field right here. Everything's highlighted. 24B, it's going to be highlighted right here. So this is going to come in very handy when they're asking for you to put information. So if you come down to the first scenario, on February 3rd, current year, a private insurance patient is taken to an ambulatory surgery center with an effusion of fluid, hydrothoracis of the right knee. A physician does an arthrocentesis and aspirates, a dressing is applied, and the patient is to return to the office in 1 week. You will use this information to fill in portions of the field by field place of service on, remember, they gave you the form up here. You click on it, hyperlink, on this field. And field 24A, the section that you are going to be filling out is only in here. Only in here. So we're going to come back and look at this. What is the date of the service procedure? Well, they told you it was on February 3rd of current year. What is the correct procedure code? So you must find the correct procedure code for an arthrocentesis with aspiration. What is the mock fee for this service? Let me tell you where to find mock fees. So I'm going to X out of the full book over here. I'm also going to X out of this job skill. We're going to scroll up to the very beginning, up at the top here, where it says course orientation. The first thing that you will see is called Practin Medical Group, Inc. It's going to open up to a separate tab. Did it download? It's going to come over as a Word document. This is called Appendix A, Practin Medical Group, Inc. You will begin to see that a lot of your job skills are centered around this made up for this book and for all of the assignments that coincide with this book. Practin Medical Group is a made up medical clinic that you are going to be using to do all of your assignments around. So this goes in to talk to you about the actual group itself. It gives you information. It gives you doctors. Dr. Fran and Gerald Practin are the doctors there, and it gives you all of their information that you will need at a later time. So keep this handy. You may want to print it out if you can. Keep it loaded on your desktop. But we're going to go down until we get to all of our codes. This also gives you codes for the office, a fee schedule. And if you notice, every code, and there's pages upon pages of codes here, every code, let's see if I can highlight it for you, is going to have coinciding fees with it. And this first column here is mock fees. So if they were to ask for a level 1 office visit mock fee, that mock fee for this 99201 code is $33.25. But you are going to be looking for a procedural code, and you will have to find that arthrocentesis with aspiration within all of the codes here. Again, there are several pages worth of codes that are on this. And what you will do is you're going to put a date here. It's going to ask for charges. Your codes will go in here as well. Kind of just jumping back to where we were. What is the mock fee for service? Well, you're going to have to find that out after you find the procedure code. How many times was this procedure performed? Well, they would tell you how many times it was performed. This just states that the physician does an arthrocentesis with aspiration, and it doesn't say that it's done more than once. So at that point in time, we would list that this was done just once. You're going to do the same thing for scenario B, and then the last portion is going over a SOAP chart note, which you will need to read what a SOAP chart note is. And on here, it's asking for E&M codes. So you're going to use this scenario of a SOAP chart note and answer these questions and look for these codes that correlate with this chart note. This portion of it, 9 through 14, you will have to document your answers on here and submit. But don't forget that you will have to upload this form with scenarios A and B on it, along with your answers on the bottom here. You will have to save and submit to be completed with this section. You only have the 3 job skills, including, excuse me, aside from your quiz that will be due for this chapter, for chapter 14. If you have any questions, please feel free to reach out to your instructor as always.